Welcome, everyone.
Hello.
And hello. Nice to see everyone. And thank you, Alex, so much for joining us. And for all of you who registered for tonight's meeting and session, the Being With volunteer training. It's wonderful to have all of you. So thank you for coming on board. My name is Kathy Matuzia-Costa, and I'm the Director of Compassionate Community Care, which is a registered charity here in London, Ontario. And we are joined with us today with Alex Shannonberg of the Euthanasia Prevention Coalition. We're very excited and happy to have all of you today because today's training is very hands-on. For those of you who have joined in the past, some of you may have decided to come on board again. The training always evolves and changes, and we are always encouraging you to participate. So if you have a question, please feel free to ask that in the chat. The session is being recorded, so just know that we are being recorded. But this is a very valuable session because for those of you who have done volunteering and training in other organizations or other groups, some of you may be part of organizations within the church or other ministries. We encourage you to invite friends and your neighbors to this as well, because the training will focus on our being with, my story. And this is a workbook that we have that's available. So if any of you need a copy of this, we can send them to you. Don't feel like you need this tonight. This is not necessary for this evening. We can ship these out to you as well, free of charge. And if you'd like to make a donation in lieu of those costs, then you can feel free to do so. And because we are a registered charity, we definitely welcome your support. So we encourage you to visit our website. We have wonderful resources there online as well on www.beingwith.org or compassionatecommunitycare.org. And so what really all you need today is just to listen. So enjoy, grab a beverage if you like, and you can listen on to the training. Myself and Alex will be speaking, and we'll be focusing on this training manual, which some of you may have received via email. This was an electronic copy that we sent out, or you could have a link to it in the email that you received the Zoom information for today and tomorrow. But regardless, if you don't have a physical copy as well in front of you, don't worry, you don't need it for tonight. You can just sit back and listen, and we'll have this sent to you as well if you need additional copies, okay? Just let us know. So without ado, I definitely wanted to start off and just say that it's wonderful to have everyone. For those of you who have participated with us in the past, it's great to have you back. For those who are new, welcome. Tonight is going to be an engaging evening filled with great information, insights, and reflections on important issues, specifically community care and being with, and our training for tonight focuses on that. Ultimately, when we do this program, we set ourselves up to learn how to be with others in terms of sitting with them, journeying with them through their stories, and creating a my story with them, which actually helps to validate and also simply give more attention to the person who's speaking, and especially to create a legacy piece for them. So these are great resources that people will often ask for, and it's a great opportunity for someone to inherit this. So for your children, if you're children and your parents are still with you, you can actually do this with them as well. You can do this in any ministry setting with a person over Zoom like this or over the phone. And we're going to speak a little bit about how important this training is and why we're doing this tonight. And I'll let Alex take that lead then. Thank you so much, Alex. And thank you everyone for joining.
So when Kathy referred to a beverage, be careful with your beverage. I want you to be able to follow, as I'm doing the presentation. So I'm going to share the screen. It should work out fine. Slideshow from beginning. So one of the big reasons why we got involved with the whole concept of compassionate community care was we recognized that there are a lot of people who need others in their lives, and in the culture today, we have a significant difficulty with loneliness. And so, I refer to this as a culture of abandonment that we live in, and it's associated, I find this whole culture of abandonment associated with assisted death. Now, what do I mean by a culture of abandonment? Well, today there is more loneliness than ever before. So we have a larger population, we have more resources, more people than ever before, yet we have more loneliness. We have more feelings of people who are on their own, who feel that when they're going through a difficult time of their life, they're having a situation where they're alone and they're lonely. It's essential that people who feel that their life lacks value or purpose, or they feel that no one cares, that they're offered support, purpose, and genuine hope from their significant community. So when we're talking about these issues, and I look at the issue now of euthanasia and assisted suicide, which was legalized in 2016, the biggest answer to these issues is how do we care for others? How do we journey with others in their time of need? In fact, with the legalization of euthanasia, the law doesn't give us any ability to challenge these decisions by physicians to say that, yes, you can die by lethal injection, but you having a relationship with another person makes all the difference in the world. Good. A recent study from the Copenhagen University looked at this whole question of loneliness, and what it was is a study that actually dealt with people who had had a heart attack. So they followed people who had had a heart attack for a series of years, where they questioned them and everything. So this was a significant study with massive amount of data, because everyone who had a heart attack was part of the study. And the study found that women who described themselves as lonely were 3 times more likely to die within the year of a heart attack than those with an active social life, and men who describe themselves as lonely were twice as likely to die within a year. So loneliness was certainly a key factor to people's health and recovery. People who are lonely were also 3 times more likely to be anxious, depressed, and they reported a lower quality of life. Now, this is from the UK. A survey of 1,896 seniors 65 and older in the UK found that more than 1 in 5, now this was a couple of years ago now even, so with COVID it would have been worse. More than 1 in 5, 22% said they have a conversation with no more than 3 people over the span of an entire week. That's a significant issue, considering that we're talking about 22% of seniors saying this in this study. A quarter of the older adults said it makes them feel good when someone smiles or acknowledges them while they're waiting in line at places like a bank or a grocery store. 1 in 5 would be thrilled if someone stopped to ask them how their day had gone. So we're looking at the serious issue of loneliness within the culture. According to the US Census Bureau, 12.5 million older adults live in a one-person household, representing 28% of people aged 65 or older. And the national poll on healthy aging that was done by the American Association of Retired Persons found that 1 in 3 seniors are lonely. And research shows that chronic loneliness can impact an adult person's memory, physical well-being, mental health, and life expectancy. More than a third of the seniors in the poll said they felt a lack of companionship. Almost 30% said they socialize with friends, families, or neighbors once a week or less. So this is a significant issue within our culture. When euthanasia was legalized in Canada, many people thought that it would only be for the very few. This is how we heard it. In fact, the Quebec Minister of Health said he thought there would be about 100 a year. That's what he said, about 100 a year, he said. In Canada, there were 5,631 assisted deaths in 2019, 7,595 in 2020, and there was almost 10,000 in 2021. So the numbers have been going up, up, up. And from June 17th, 2016, which was the legalization, to December 31st, 2021, there was 9,796 in Ontario alone. Since then, we actually have now made it to the sad number of 11,000 deaths in Ontario alone. What is more concerning is that the trend is constantly up. But the big question is, as I'm omitting somebody, why do people ask for MAID, euthanasia? We are told that people are asking for euthanasia because of pain or suffering. This is what the media is telling us. This is what the culture tells us. But in fact, data shows that very few people actually ask for their life to be ended for these reasons. There are some people who are radical autonomous. We know that. They're demanding that their life be ended by their choice, as they would say. It's my body, my choice. They want to die by lethal drugs. But they're actually the minority. They're the small group. They're a tiny group. Most people ask for death because they are at a difficult time of their life. They are feeling lonely, depressed, and socially isolated. They've lost hope, meaning, and purpose. So they might have a significant health condition. I'm not questioning that. Nonetheless, the biggest issue that's driving this whole euthanasia issue is loneliness, depression, social isolation, loss of hope, meaning, or purpose. An Irish study that was conducted over a 6-year period found that a wish to die was almost always linked to loneliness, and it was most often linked to loneliness and depression. Now, assisted suicide is not legal in Ireland. What happened is when they were debating the issue a few years ago, there was a serious study that was funded by the government that was done by a major university in Ireland, and they looked at why were people asking for their life to be ended. That was the question, the wish to die. The study followed 8,174 people. That's significant. It's a significant study over the age of 50, and it found that 3.5% of the people had a wish to die. That's pretty significant, actually. Those who had a wish to die, 72% were identified as lonely, and 60% had significant depressive symptoms. So we need a culture that cares for people, not one that kills. Euthanasia also threatens my life. This is the big issue here. Human experience tells us that it's normal for a person who's experiencing serious illness or personal difficulties, who are lonely, that they will also fear for their future, that they will question their purpose for living. They experience existential distress, situational depression, and they lose hope. This is not a new idea. This is not a new issue. This is something that has always been within our human condition. Sadly, we've always had suicide within our human condition. What is new now is when someone's experiencing these very same feelings, that now a doctor or a nurse can go ahead and kill you if you've asked for death. Suffering alone, which is very difficult to go through, loneliness, isolation, depression, loss of hope or purpose are leading reasons why people ask for death. And all of these experiences are normal feelings. They're all normal human feelings. We all experience these feelings. So by being with others, you make a difference in their lives. You help protect them from the concept of euthanasia. The Compassionate Community Care Charity was created so we can, so we can train people to be with others, to visit others, to allay that loneliness. But also by doing that, we recognize that we'd also be caring for our own people who we care about. And at the same time, we would be lowering the issue of loneliness and social isolation, which leads to euthanasia. So Compassionate Community Care, we're training. We have the training program that you're going to see today. And our concept is we can change the world one person at a time. We can protect people by caring. By visiting and journeying with, being with, and caring for others, what are we actually doing? As I'm admitting somebody, we're affirming a person's purpose for living. We reduce their loneliness and isolation. We help them find a way through their depression and isolation, and we allay their fear of suffering. As I always tell people, God created us to be with others. Now, if you don't believe in God, I'm assuming most people on this call do, but if you don't believe in God, then let's just put it this way. As a human being, you are made to be with others. That's how you are. That is what's normal for the human person. Interconnectedness is essential to the human person. That's how we tick. We're all affected by the legalization because we're all human and we all experience similar human emotions and feelings. Cultural loneliness affects our health, it affects our quality of life, and it can be a threat to our life. We are focusing on visiting the lonely and caring for our members, who we know, our parishioners, people who we are in contact with, whether that be through a church group or through a community group. It is our goal to replace the culture of death with a culture that cares. Compassionate Community Care basic information. So I'm going to admit this person coming in. I'm going to stop my share. I'm going to go to a video. I think this is a very good video that I'm going to go to. It's now, first of all, just so you understand that I have to optimize video clip and share sound. Okay, share. Okay, so what this is about is just, can you guys see this? Is this on the screen?
Yes.
Yes.
It is on the screen, so
Yeah.
I can make it full size. Perfect. Okay, so what this is in the UK, they quite a few years ago, the government had identified a serious problem with loneliness, so they set up a government department that just sets up programs to help the elderly in their loneliness. And here's a little video that is connected to that work of the government of the UK. You'll notice that if you're looking up elder loneliness on YouTube, you'll notice quite a few good videos. Most of the best ones are from the UK, from England.
If you've never been lonely, you don't realise what it is like.
It feels as though you've been dumped in the
deep end and there's nobody there to rescue you.
Well, you go hours and hours, never speak to anybody.
I don't think you'll ever get used to it. You know, it's always loneliness.
How do you measure loneliness when even trying to talk about it takes your breath away?
The room's just empty.
"91-year-old Margaret Nicholas has lived in this house virtually her whole life, first with her parents, then her husband and family. 2 years ago her husband died. Now it's just her.
We used to do the garden together, do our shopping together. Everything was done together.
But you obviously miss him.
I do.
Margaret's granddaughter takes her shopping and neighbours pop in to check she's okay. But it's everyday company she misses.
Some people would think me a bit odd, but I do chatter to my husband. I do it so I'm sort of, speaking.
That's the wife with a cousin.
Roy Croucher lives a short drive away. He and Margaret have loneliness in common. He lost his only son to cancer and then his wife for 50 years.
I'm always hoping that the wife will come through the door, which she never will. If you go out, you come back, and you come back to an empty house, and it's loneliness again. And you're always waiting for somebody to call.
Roy says he's lucky. A friend and her family see him most weeks. But like Margaret, some days the only voice he'll hear is a call from a phone befriending service run by volunteers.
Judy rings up on a Saturday night, because last Saturday she was the first person I spoke to all day.
And that's a long day.
It is a long day.
And how much difference has that made, that phone call that comes on Saturday night when you haven't spoken to anyone else all day?
Well, I always look forward to it. I always put that phone on that seat, ready to pick it up. And that's a great help.
The campaign to end loneliness says it should now be treated as a public health issue. Identifying the most vulnerable is critical, then offering support to cope with the bewildering and painful reality of ending up alone.
I've never been on my own ever before. No.
And so getting used to that has been hard.
It has. I don't think I shall ever get really used to it.
It's just something that is thrown at you, and you can't throw it back to anybody. You've got to just carry on.
Thank you, Alex. I always wonder when I see that video if those two people could just, team up and start talking to one another. It'd be so great. That matchmaker in me wants that. So as we pop up the next screen with our program for this evening, we will focus on the first chapter of our book that if you have it in front of you or it's electronically in front of you, you'll see it's our human needs. The Being With program, which is really wonderful, you have this opportunity to participate in someone's life very closely. And as you start to speak to them on a weekly basis or monthly or however you decide to connect with them, the relationship continues. So even after you've had this experience and you are able to cover this book and ask some of these questions which are in the book, which again, like I mentioned at the beginning, we can send this to you. Questions like, what did you do after school and on weekends? Who are your childhood friends? Who are your parents? And did you go to school? What schools did you go to? Things like that. You can actually participate with someone in this process and have them share their life story with you. And this could be your parent, relative, an elderly person in your community, in your church, perhaps. If you're part of CWL, that can be a great opportunity as well to have members reconnect with the organization and with your group with this great resource. So just let us know if you need additional copies of this, and we'll ship those out to you. So starting off here, when we're talking about the Being With program, we want to focus first on the philosophy of why we visit. And ultimately, like Alex said, we want to encourage you to reach out to people who may have not been in contact with you with an organization like CWL or Knights, or perhaps even someone like within any type of setting organization. Some people, for example, in hospitals or nursing homes, they may be shut in, they may be socially isolated, they might feel very far removed from their loved ones or relatives. So this is a great opportunity to reach out to those people, because you're literally offering hope to those people. And what's wonderful about this is that you're actually part of the solution to this problem or epidemic of loneliness. Like the video we just watched, you can see how important it is. Sometimes just that one phone call, that one visit with that elderly person will make all the difference. And this is why it's so important too, to connect with others who want to visit with you. So teaming up in groups, in duos, is a great idea as well. And why we often do this is we find that there is this really strong lack of companionship among, groups, and especially among the elderly. Over COVID, we saw a great deal of people fight depression and isolation, and simply, thoughts of feeling abandoned during COVID, because a lot of people felt that they were shut off from connection with their families, with their relatives. They couldn't see people. So this program, by doing this and visiting with people, being with them over the phone, Zoom like this, FaceTime, whatever method you choose, or what they're able to do in person is the best, obviously. But however you can connect to people and reconnect in them that vigor for life and that zeal for living will definitely reduce loneliness and isolation. Definitely what this program does too is what we'll go over this and tomorrow's evening session is you'll hear how you can look for signs of neglect or potentially even abuse, elderly abuse. And also this will give you a sense of longing and value, but not only for you, but the person you're visiting. So what's wonderful is this actually helps encourage people that when you visit with them, they feel like they actually have a relationship, a friendship, an interest in their own life, and they're someone who is in front of them sees interest in their life. And what's really great is when you feel like you have that attention from them, and they will be so grateful for that. And they often find that this is the best part about this. And thank you for chat. Any of your comments in the chat forum, please definitely let us know if you'd like a copy, and you can send us your email with the address so that we can send you the copy of the book. So jumping right into this, chapter 1, our human needs. Oftentimes we talk about our human needs, and there's 4 recognizable needs. And what that means is the physical, mental, social, and spiritual needs are what we're talking about here. And when we're looking at the physical needs, oftentimes, for example, someone may not realize that they need things like exercise, nutrition, hydration, and sleep. Sleep is vital. I just spoke to a good friend of mine, and after 2 years, over 2 years of COVID, he said that the number one complaint that he hears from people is not enough sleep. And especially that was exacerbated by COVID. People are not getting enough sleep these days, and on average, people get anywhere between 3 to 5 hours of sleep a night. That's very low. So definitely encouraging the person that you're meeting with to make sure they get enough sleep is really important. For people who are over 65 years of age, 90% take at least 1 drug per week, and that's more than 40% take at least 5 drugs per week. So these are really important points to keep in mind and mention, that drugs that are prescribed have a big effect in bearing on a person's lifestyle. One thing we want to know too, and make sure that you encourage you in your visits, is that people react differently to medications. Thank you, Alex. And so what we find is when you're speaking to, someone, depending on their schedule in their time, depending on when you see them, you want to ensure that they actually have enough hydration. And, hydration and medication is very important. So as people age, there's actually less water in their bodies. So you want to ensure that for the elderly, medications that dissolve in water require lower dosages because they remain highly concentrated in the body. So, and also seniors, they might have more fat in their bodies. So what that ends up meaning is that medications will dissolve in the fat and therefore they'll accumulate more so. So they actually can remain, the medicine will remain in the body longer. The kidney and the liver may not necessarily work as effectively. So you want to ensure that the dosages of their medication are keeping up with the type of hydration, the amount of hydration that they're getting. And definitely we want to encourage people to, pay attention to what they need in terms of medication. And you can be a part of that as well, ensuring that they get what they need. In terms of mental needs, our brains, this is actually really important because we often don't realize how important it is that we require a lot of stimulation to stay healthy. And so when 2 years of COVID have happened, we've noticed that a lot of people have not been stimulated. So when I speak to people, oftentimes, in the last even just a couple weeks, we've been reconnecting with a lot of people. And oftentimes you'll find that the first initial conversations with people are really long. And people like to stay on the phone for longer. They want to catch up. And, you might not even get into the actual workbook per se at the beginning because people are often just trying to kind of transmit or share with you what's happened with them, what's going on in their day. And they're happy to hear that someone is listening. So definitely just keep in mind that stimulation is important. The flip side of that is that people who are not stimulated oftentimes will result in having a lot of time in front of the screen. And that can actually lead further down to sleep issues later on, of course. So they're all related, but depression can come and start creeping in as well. If people are not stimulated or if they're not active during the day, it's hard for some seniors to actually be active. As we talked about the case of the lady who was saved from euthanasia, they are shut in literally and may not be participating in a daily lifestyle that you are used to. So depression creeps in and it's a serious issue. Another issue is dementia, which it affects, 1 in 20 people over the age of 65 and 1 in 6 for people over the age of 80. So, things like, for example, gardening, playing a musical instrument, you could bring puzzles to your visits as well, or doing puzzles together or games even, are really nice. Cards is a great activity for someone who wants to be active. I remember when we used to visit seniors' homes growing up in high school and then later in university. We would actually go to seniors' homes and there was a bowling alley that we set up. So we'd have pins at the end of the room and people would be in their wheelchair and they'd throw the ball down the, just a little bit of a hallway. And that was exciting for them. They had an activity, it was something different. And, you could be creative and come up with different things like that as well. We would have music playing. And oftentimes, when you are visiting with people, it's really nice to have a piece of music, even on your phone. You can bring it with you. You could have on YouTube, play some of their favorite classics or oldies perhaps, or if they're culturally interested in certain types of music, you could play that type of music for them. So that's really great. Another thing that you may want to consider is also social needs. And one thing that we see with especially being social, COVID shut that down completely. COVID literally did a number on everyone in terms of social stimulation and social needs. I know after looking at kids and especially how kids react, if I knock on a door, which recently I had to knock on a few doors, I actually noticed that every time I knock on a door, the kids just fly to the front of the home, right? And they'll often, greet you at the door, or sometimes, there's no parent even with them. I said, "Oh, is your mommy home?" Because, so-and-so wants to speak to you. So what's really funny is, kids really pick up on social interaction, and especially even more so for seniors. And I find the two really relate. So my kids love being social and being out with people, and similar with our parents. I notice even with my own family, you don't call your parents or your in-laws regularly, they'll start, wondering what's wrong. So the lack of social connection is really key. With phones, especially, you want to also, and I put a note for myself, is when does the person that you're going to be speaking to want to be spoken to? Do they like daily, weekly, monthly, bi-monthly? So how often does, what type of frequency does a person want to be spoken to? Is that's really key and important too. Some people like to be, on the phone for hours. I'm not that type of person. Maybe you are, perhaps. That's great. But just noting how that person likes to be in relationship with you is really key. And lack of social relationships is a strong risk factor for early death. So we saw this in studies recently wherein people who actually had, significant drops in their social life, and as they age, especially that can be the case, they actually had a stronger risk factor for early death. It's almost like smoking, wherein you actually feel that you don't want to live. So people actually start slowly, depreciating in their physical abilities and also in their mental, and also, it's all dealing back to social needs. So social isolation is a huge factor. People often will find that if they have a small social network, or they're not married, or they don't participate in many activities, this has an increased risk of dementia associated and cognitive decline. So we find that most seniors will feel connected to their family, but they'll fear being a burden. So people want to be close to their family, but they're worried about the burden. So it's like a dichotomy that's happening, a dual, relationship. And what you want to ensure is that you don't make them feel like they're being a burden on you. And that's why I think it's important too that we resolve these issues and be able to speak to people and offer them strong social relationships. A lack of social relationship here is a strong risk factor, like we said, for death. One thing you want to do is people may often say that they're tired. This is another thing we often see, is that when someone says that they're tired, they think, or the need to speak to others, they worry about, for example, they say, oftentimes they'll say, I'm exhausted. Well, what does that mean? Exhaustion actually means that they feel that they're being a burden. And tiredness, exhaustion, or that type of language will actually show you inside what's going on in their body, what's going on in their mind. So they may physically not actually be tired, but they're just exhausted from living. And this is also a warning sign and a key communicator of why a person needs to be visiting, or at least be spoken to on a regular basis. The last thing, communication, is that when people are speaking, you can talk through electronic devices. You can talk through Skype video, Facebook Messenger. There's a chat form of that, Snapchat. Any type of, communication method is great, as long as they're comfortable with it. So if they need some training in that, you can offer that. But Zoom like this is fantastic for a lot of people, because it helps also relay that kind of sense of being in relationship. So it's really key that we establish that with them as well. When you first start meeting, you'll notice how they want to be communicating, and that's great. You can continue that method. When it comes to spiritual needs, this is another need that we see, especially with groups like CWL. We often will talk about this because spiritual needs involve your relationship with you and your God. And ultimately, however that's, bigger power is playing out in that person's life is really important to them. And, there is something sometimes where we find people will need actual healing. And that may be something in the relationship that's unfolding. As you get closer to someone and you're back in communication, you may actually notice that the spiritual needs are not being met for that individual, and they are actually seeking out someone to help them in healing. And, this in particular, sometimes this may come back full circle to other needs. For example, things that started in their childhood, so they may need some counseling. I just spoke to someone who started seeing a psychiatrist back in when was it? When COVID started in February 2020, he had the intuition, the insight to actually start seeing a psychiatrist in May of the same year, 2020. He's been seeing them since. And that psychiatrist, who's over 80 years old, said that in his 50 years of practice in psychiatry, he has not seen this number of anxiety ridden and stressed patients that he has seen that have developed in the last 2 years. That it's a phenomenon that he's never seen before, and it's literally due to COVID being shut in. So spiritually, people are really malnourished oftentimes, and what that means is it can translate to religious needs. If a person is religious versus spiritual, or even existential, they may actually find that there's certain elements of that relationship and spirituality that they need to actually have happen, and you can be part of that, which is really wonderful. You can actually participate in their spiritual needs as well, offering, for example, certain prayers. If they're religious, looking into the type of religiosity that they pertain to and they practice is really key here. So for example, asking them, oh, what type of religion have you practiced, or do you continue to practice even any type of religion, and being specific about that, what kind of needs that show up. Existentially, people will often find that they need to meet certain needs as well. And what that ends up being is there's certain cultural needs as well that may be part of who they are. For example, if they have, they need to cope with their situation. They may need to come to terms with who they are now, that they're not the same person at 75 that they were when they were 55. And those are existential needs that need to show up for them in terms of how to solve or resolve those issues. And that's, again, something that we will deal with you if you ever need or have need that support. Also, if you're part of a group like CWL, you can actually speak to your pastoral associates there at the church, your parish community, speaking specifically with a priest, for example, about certain needs that show up for people, because they may be part of that solution as well. In terms of need for inner peace, I think this is really key, especially in this relationship that we're in with this woman. This seems to be a really key point. As people age, they might need to have inner healing and inner peace. And if there's unresolved issues from their past, for example, if there was an abuse that happened or unfolded, or if there was some kind of neglect in their personality in the relationships with their children, for example, that is something that will show up later in life. And that may actually be the cause of their anxiety in later life. They may need to resolve those issues, and you could be helping them with that, allowing them to speak to a counselor, or even having someone available to speak on an ongoing basis, just as to you, to counsel you on how to best handle that, would be really advantageous. And then the final thing is, if they are, for example, speaking to things of giving, so the need for giving, oftentimes people feel that as they get older, they want to pass on their experiences to the next generation, and they want to be assured that one's life has meaning and value and purpose. So that basic need may be fulfilled by using the My Story program, which is wonderful, because by doing this with them, you're actually putting their questions, these answers of from the questions in the book into a book, and they can actually pass this along to their children and then their grandchildren. And this becomes a legacy piece, which is really wonderful. Oftentimes, life satisfaction entails many areas, like intrinsic value, for example, their life in general and their health. They can impact their social friendships, but also it's external. So for example, what do they do? Where do they live? How do they work? And things like in the future of perspective, future financial security. So sometimes we'll find now, especially when people are looking at end of life, they may not see much of the future in front of them, but you can help do that by creating a legacy piece like this and encouraging them to participate more in areas of their life that they may have forgotten. So one other thing I'm just going to quickly mention here is that many seniors, when they're questioned about the term need, they may actually prefer to speak about it in terms of wish. So needs, you might want to replace that or interchange it with the word wish. And so do not ask maybe what are your needs, but for example, rather, what do you wish for? And that's a really good way to move you into that direction in terms of understanding that. So that's great.
I was going to make one quick comment, and that is just about the spiritual needs. It's because of things that might have happened when one was younger, we have to sort of be very careful with that. So as Kathy was saying, you direct them, you ask them about things like how do they still practice and things like that. And if they do, then obviously they might want to pray with you and that kind of thing. But others might have how would you say, a very negative reaction to it. So then we tread very carefully, because obviously they might have a lot of pain, and that's obviously an issue we have to be looking out for.
Thank you, Alex. That's great. The next point we're going to mention here is chapter 2, which is visiting advice. So because of COVID, everything has happened and changed in the last 2 years. Whatever your criteria is in terms of making sure that whatever guidelines are in place, if you're going to a senior's home, nursing home, long-term care facility, if you're going to a hospital or into someone's home, you want to make sure that you're up to date in terms of if you need certain things like area guidelines or protocols, that you're following those. And that's a really key thing here to mention. If in terms of personal protective equipment, if you need hand sanitizer, face masks, or gloves even perhaps, that might be something you want to investigate or look into. Just recently, we actually came up with, someone came up with the idea of booties because booties often tend to help people when they get slipped on. And if you're going into an area that's more sensitive, for example, or a person is more sensitive, they might really appreciate that you're wearing booties or change your socks or whatever if you're walking into their home or their living environment. One more thing here is if you are part of an organization like, a visiting group, or you want to create a compassionate community care group like this, which will go out to visit people and shut in people who are in shut in, you may want to make sure that you go through the process, or it's required of you to get a criminal record background check. So in Canada, for example, you definitely need that to be a visitor and to be a volunteer. You may also participate in the vulnerable sector check. And sometimes you might need to pay for that. So if that's an issue for you, just, reach out. But usually if you're part of an organization, they'll pay for that or compensate you for that. And that's simply when you go to the police, they'll give your information and they'll check your identity and offer that. And oftentimes you just need a letter from whatever organization you're part of to facilitate that. If you have more questions about that, feel free to reach out to us, okay? Definitely for the first time when you go out, before you go, you want to dress appropriately, and you want to ensure that you're arranging the visit adequately. So, finding out when are you going to speak to the person, when are you going to meet them, how, where, the details around that visit. What do you plan to do with that person when you visit with them? Do you want to go outside? Do you want to stay indoors? Do you want to play a game? Do you want to, just speak or get right into the My Story book, for example? So that's really nice. If you have an organization that you're going through in visiting with, then you want to represent them and you want to perhaps wear an ID, then definitely make sure you have that with you, and just identifying who you are and who you're with. Making sure that you're arranging the visit properly. You want to when you come and you arrive to the visit, making sure you have proper hand hygiene. So ensuring that you wash your hands before you go and when you arrive, definitely that's a really great courtesy. Over COVID, we saw a lot of times, I just had a baby 3 months ago. So I had my 4th child in the last 6 years, that just 3 months ago. So when people come over to our house, oftentimes they'll wash their hands, and that's just a really nice gesture that people recognize. Okay, yeah, you have a young one, you definitely want to make sure they're healthy. You don't want to impact them in a negative way. So when you're starting the visit, definitely making sure the one thing too, that you don't visit when you're not feeling well, because that can impact that person who you're with, especially if they're in a vulnerable state. They might be going through treatments or, for example, have cancer. You want to ensure that you're feeling well. Obviously that, excuse me, when you start the visit, you want to call, or you want to make sure they know you're there. Introducing yourself, knocking on the door is really important, and introducing yourself to them and anyone else who's in the room. So for example, they have a roommate. You definitely want to ensure that the other person in the room knows you're there and for what reason you're there, and knocking before you come in is really respectful, especially if it's a hospital room or some type of common shared space, that everyone that else is in that space knows who you are, and you acknowledge them as well. And definitely want to be attentive. So during the visit, making sure that you're listening to what they're saying, their needs are. Oftentimes, I'd say, my husband always says that we have 2 ears and 1 mouth. So we want to ensure that we're listening double the time and sharing with them, after they've actually shared more with us. So making sure that you're sensitive to that, and being kind, obviously, and compassion is really key here. And knowing that if you've set a time up with them, that you are in fact punctual and you come on that time. So that's really key as well, that if in case something happens, you cannot come, then you let them know that. And that's really important too. For example, also too, we want to note here is that if you are visiting with someone who cannot speak, that you go in pairs, so that conversation can include the person that you're visiting with. Sometimes there's people, for example, like this next point here, people might not be verbal, or they're not able to communicate. So you will often have to rely on someone else too to interpret sometimes what they're saying, or if they're not able to communicate with you, maybe they need a translator. That's something to keep in mind mind as well, okay, in terms of communication. And definitely brainstorming creative things that you can do together is really important, because, you know, you're spending that time with this person and you want to make sure it's fun. You want to make it fun. So definitely encouraging, you know, some play perhaps, or some creative ideas. You can add a walk into that visit as well. It's really nice. It will perk people up in terms of if their abilities, they can allow it, then, you know, oftentimes a walk is really beautiful because you get to go outside and experience that. Or even sharing, for example, a cup of tea or preparing something like that for them will be really special. And of course, you know, it's important to always be sensitive when you're talking about communication. Here, language matters. So for example, we want to be always person first. When you're speaking about someone with a disability, you will not say disabled person, but you rather will say a person with a disability. Similarly, instead of saying an autistic child, you would say rather a child with autism, or an individual with epilepsy versus an epileptic. So these are positive communication strategies and ways to communicate about people, and being very sensitive to who they are, because language obviously matters. People, when you speak with them, obviously you want to be treated the same way, and you want to treat them with the same respect you would expect back to you. So always ask to do something before you do it, and be willing to accept no. So if they say no to something, then be simply respectful of that, and honor their wishes. If they don't want your help, great. You know, just respect their personal boundaries. That's really important. Being polite and cheerful, like here it says on the slide, is really key, because communication oftentimes is, you know, two ways, but they can hear it in your voice. If you don't want to be on the call, or if you don't want to be in the room with them, then they'll notice that. So just being really polite, happy, cheerful, optimistic is really important here. And these are great reminders for everyone, because even, you know, people, for example, might become jaded over experiences. So as you are engaging with that person, always coming into that conversation with a positive outlook is really key. I find especially the point of smiling when you're on the phone with someone, they'll hear the smile, right? So that's really nice too. Being a good listener, we want to encourage them to speak. So being a good listener means opening the space up for them to share, giving them time to respond, and being definitely alert, aware of what is happening around you. If there's someone, you know, going into your space, then you want to communicate that and making sure that they're comfortable with what's happening. So that's really important as well. And always remember to be confidential. So anything that a person is sharing with you is strictly confidential, and you want to ensure that it's kept in confidence with you, making sure that you're not sharing any information. After a visit, often, we're going to talk about that in a second, but definitely keeping that in mind. Always ask first. And for example, if a person has a chair, and they have a wheelchair, you definitely want to ask them to be able to move that chair, to assist them in any way. So definitely, please, you know, feel free to do that and ask for those things before you actually do certain actions. The next point here is when they're nonverbal. So thank you, Alex. If someone happens to be nonverbal and they are communicating in a way that's nonverbal, it's very important to be listening. This, for example, comes into expression, especially now with facial expressions. So you'll notice with people, when they don't understand you, they might seem perplexed, making sure that you notice these things. These are small cues, but they're important. And that will actually benefit you in the long run, because if they don't understand you, they're going to try to transmit that to you in nonverbal cues. So by you being responsive to that, and actually, you know, turning to your whole body towards them and acknowledging what they're saying, it's really key. One thing you'll find is oftentimes people will notice is facial expressions of fear, sadness, anger, impatience. So that's something that can be revealed really quickly, and that will affect the message during a conversation. So making sure that you are in tune with how you express yourself too is important. For example, it's especially important on how you feel about what they're saying. So when you communicate back to them on what they say, that's really special for them to receive that, with knowing that you are appreciative of that they're sharing things with you, and that you're acknowledging that, you know, they're sharing and they're partaking in this experience with you. So you know, it goes both ways, that you're able to transmit that information to them back, and also capture at the same time with something like this, and they'll appreciate that. So in terms of touch, you can hold their hand if they're comfortable with that. That's another element here. You can respect the wishes of those that don't want to be touched, because oftentimes we see that people may not want any physical impact or touch on whatsoever. When it comes to your voice and being sensitive to the feelings behind the words that you're saying, people really understand the tonality. So when you're speaking over the phone, people will notice, okay, your mood has shifted or your attention has shifted when you are speaking to them, when you're busy with if you're, let's say, out and you're driving versus if you're in a room alone and you have they have your full attention. So voice is really key. Eye contact, obviously here it's a little different because I'm speaking to you through this computer, but I'm speaking to you up above, and hopefully you can hear me. But eye contact is really important. And if you have your eyes down low like this, you may not be as interested in speaking to me, and they probably won't be interested in speaking to you maybe either if you're not really focused on them in their facial expressions and being in contact with their eyes. One thing too is any avoidance of eye contact can reveal that a person is uncomfortable. So noticing that in them will help you also realize what type of comfort level they're at. And your eye contact reveals if you're interested in them. So definitely keeping that in your minds and bring that to attention. In terms of body movements, we often see that the way a person sits, if they're upright, they're responsive, they're actually very engaged in the conversation and they're interested. If a person is looking sideways or distracted or down, that person often will, it may neglect to, want to participate. They may not be interested, or they're simply not feeling great. So just being in tune with that is really important. Body movements, if they are sitting, walking, standing, fidgeting, those are all things to keep in mind and to notice. It's indicative of their feelings. And ultimately, we want to take notice of how they move their hands. So if they're fidgety or if they hold their hands tightly together, it's all important. And it actually helps with your experience and understanding their experience. In terms of appearance, the appearance of how they look will reveal how they feel about themselves. So sometimes you'll notice that people will not be as put together maybe as they used to be or how they prefer to be. And that's also indicative too of if there might be something like elder abuse happening. So if a person is really if they look unkept, that's one thing, but there could be signs of elder abuse. If, for example, they continue to not have their clothes washed, or if they're not seen in new attire that, at least something that's different than the last time that you saw them, that could be a sign of neglect potentially. So that's something to keep in mind and aware of. When it comes to, for example, a cultural difference in dress, it's also important to know the influences of how a person appears to you. So if they dress up to you, obviously they're looking to see that you understand that that's something they're doing for that visit, and being appreciative of that, it's really key as well. It's very sweet to acknowledge that. And the next point and last thing we want to mention here is space. So a person's personal space is really key and important. Be aware that culturally, for example, if you're a male speaking to another male versus male speaking to another woman, space is really important here, and it plays it out very closely in terms of how you interact. And so culturally, social status, prejudices, things like that are really important for when you're keeping space and boundaries, and often are factors in person's needs for personal space. And it's always important to be sensitive not only to the body language of the person, but also to the nonverbal cues of others. So to know your own, space and to also evaluate how you feel about that zone in terms of that comfort. When we're talking about emotions, personally, a person may actually appear to be anxious. They could be showing signs of being discouraged or frustrated. This is important to recognize that, and don't take their unhappiness personally. So if a person happens to be upset that day, this is really key, and I have to remind myself, if someone's having a bad day or bad day moving into a week or month, you want to be able to break that apart and just, hear them out for whatever it is that they're needing attention to right now. And especially if something needs attention later on, then you note that, and then you can respond to it adequately after the fact. But if something is on their mind, or if they show up that they're frustrated, don't take it personally. Show them that you understand their emotions, that they're feeling frustrated or, anxious, and that you're here to help, that you ultimately want to help them. And you can validate their feelings and say simply, I understand how you may feel X, Y, and Z. And, especially knowing that you're there to listen is really important. And that will encourage them ultimately, knowing that you're there for them. Okay. You can also reflect with someone when they're saying something. You can reflect back to them and tell them what they have said. So you can say things like, oh, so I hear that you're saying that you feel frustrated because Tammy didn't respond to your needs. Okay, great. And they understand that you hear what they're saying and you're validating their feelings and you're validating their experience. You may not, agree with their experience, but you're at least validating it. So that's really important. And you want to be aware of their current or past illnesses as well. Sometimes people will share with you about an experience like a stroke, and they might become emotional. So that might actually draw emotions up for them. Just making sure that you understand their feelings and validating them, that's really important. And although as well, I'm going to bring this back up again, is if you might not agree with them, understanding that they may feel a certain way is key. And often we realize that people might want to argue sometimes on the phone or in person. People love to argue sometimes. They find that's the only relationship that they're comfortable in, is actually being in an antagonistic role. And it happens especially when people get older, I find, because that's the only time they find they can get attention, is when they're unhappy. So we can transfer that and convert that and say, listen, I see that you're, upset about this, but look, you got this instead. And you actually got a positive, effect to whatever it is that negatively feels like they impacted them. So you can flip it and also be versatile with them. Some tips here is using statements. For example, it is windy outside, it makes me feel, etc. So when you're talking in conversation, you want to obviously use statements that they will understand. Some people may view questions as intrusive. So I often will say this, for example, people will say, oh, don't ask me about my background. Okay, well, I'll say, well, I'm Polish. What's your background? So I'll put out my information first so that they can feel like they can supplement what they want to say about themselves after that. So I've disclosed something, you can disclose something if you decide you want to. So statements are really helpful that way. And if someone has, for example, memory issues, just be conscious of that. For example, with dementia, you may want to ask yes or no questions because you don't want to have to rely on recall and memory. So that's a good opportunity too, is just to ask questions that that you can have a yes or no response to. And if you want them to make a choice, ask them one question at a time. For example, would you like some tea? And then pause or wait for the answer and then move on to the next question. Definitely encourage people to talk about their past. When they speak about their past, encouraging them to talk about it is really good, because that's ultimately what you want. Part of my story, excuse me, is that the stories may become clearer to them than the present. So when they reflect on something, for example, like who were your childhood friends, they might actually come back with a long response. If you ask them, what did you do yesterday? They might say nothing. So they actually have a longer, train or sense of memory from their past than they do to recent events, because oftentimes the days go faster and they feel like they might not have all the the details of the day. So everyone has a story. We definitely want to encourage them to share the memories, and you might have, for example, a plan to go through the book and actually speak to them about 2 pages a day. Well, that might completely be thrown out the window, because sometimes when they start on a story, they just go and that turns into something else, and they talk to you about last week instead of last 10 years. So definitely be receptive of that and encourage them to continue to speak to you about what is important to them. And you can actually help them by sharing memories with them. Like, for example, if they have albums or they have pictures in their room, you can actually point out to certain things and say, hey, what's going on in this picture, or what happened in that shot over here. And that helps them as well to give them recall and bring back the memories that they have. Thank you, Alex. One thing too, we want to make sure is when we're speaking, we don't want to do these things, which is being impatient. Oftentimes, I personally have 4 kids, and I find that this is my biggest I guess you could say, issue is that I'm not as patient as I used to be. I need to work on this personally, but I do give everyone often the time they need. And I find that it's important to be patient. So giving people that window, that time to express themselves. One thing I'll notice is as people get older, they often will tend to become more impatient. So their time, as though, it seems like they have all the time in the world, they continue to rely on time as a factor that is escaping them. And so they continue to say things, oh, I've wasted this, or I've wasted that time talking or doing this, and not doing what they feel like they should be doing. So just, keeping that in your mind. It's a different relationship of time, I think, for as you are, in your years of having children versus when you're older. Because when you're older, you might think of time as projects and goal oriented, and did you accomplish something today? And if they didn't accomplish something, then they feel that they've been a failure. So that will hit them harder than it would maybe to you, because you have more relationships in your day than maybe they do. So that's one thing to keep in mind. Arguing is definitely a big no. We try not to argue with anyone. We want to ensure that people are heard. If a person feels like they want to argue, you can let them just come out and vent to you, and just say at the end, hey, I appreciate you sharing with me your thoughts and feelings. But you don't need to validate and continue pushing those narratives, because that's just going to continue and snowball. So definitely, I wouldn't argue, and not to give advice, especially, or solutions, unless they're asking for it. If they, for example, ask you about their physical conditions or their health or medical situation, please don't create false hope. Oftentimes, medical situations don't always get better, and we're not in that position or authority to decide on anything. So we definitely don't want to touch on those topics if we can avoid them. Don't obviously being honest or genuine is really important. So dishonesty or being, fake is not something you want to do. You can always tell if a person's actually being honest, and it takes time to form trust and friendship. So you definitely want to create that opportunity by being as honest and genuine as you can, and not being judgmental. So if a person is, for example, upset about their life, or very upset about their situation, or their situation with their children, for example, you don't want to be judgmental in that, and keep an open mind, because your understanding of that situation is one-sided from that person, and there could be a whole other slew of effects and factors that are actually participating in that life, in that person's relationships on the other side. So we don't know about those, and we just definitely want to be judgmental about any of that. And definitely don't whisper or talk behind someone or in front of them to others. This is one thing, especially if they have a caregiver. The caregiver will try to feel like they know you, or they know that patient or that person better. So you don't want to communicate with them or whisper to anyone behind anyone's back, or especially in front of them, because that will often it can be very dismissive and rude. So we want to encourage them always to be open and honest, and sharing that information. Whatever you need to share, you speak openly to that person first, and make sure they know it's okay, if it is all right, to actually share it more with others if it's necessary. In terms of talking in front of people, don't ever speak as if they're not there. Obviously, this is intuition and common sense, but oftentimes we see common sense is kind of gone. So we want to make sure we don't do things that will offend anyone. I know everyone here, everyone's on the video, you know how to speak to people. So we want to make sure that we acknowledge everyone when we're talking to them, and we don't dismiss them. And also to keep in mind this, don't discuss your own troubles. I used to be in a role where you help people have, obviously in every role, you try to help people have their best experience. So you don't come into that relationship, and you don't come into that day or that job with your own troubles. So with this, My Story workbook, you're actually helping someone with their own experience. So you definitely want to ensure that your troubles don't affect any of that. And you want to ensure that it's as neutral as possible coming from your side into that relationship and that friendship. When it comes to speaking to them about their illness, you don't want to have them disclose information to you that they wouldn't want to. And you can always take, a note of what they're saying to you when it comes to their illness for your own information. But don't, force them to have to talk or disclose things to you. If a person doesn't want to talk, sometimes, they may just not have a good day. They don't want to speak to you. Just saying, hey, I'm checking on you, hoping you're okay. okay, great. If today's not a good day for you, we can definitely catch up another time. When would be a good time for you? And, letting them know that you're open to them another time when is convenient for them. And when you're speaking to someone, your tone of voice is really important. Making sure that you're being natural and being, as I said earlier, genuine is important here. In terms of your volume, that's also key, is not to speak too loudly. Some people might need to speak loudly. There's a lot of people in my life love to speak loud. my mom, my dad, sometimes, they love to really come on strong. But in our family, it shows they care. So if if they don't speak too loudly, they think you're not listening. So, either way, that point is, definitely you want to make sure that you speak to a tone that they will understand and appreciate you, and not too much that it'll offend them. And then, of course, if there's any mistakes, or if there's some things that they've neglected to share with you, or that you feel like it's not consistent, please don't point it out to them. As people age, and even my own life, I notice this, sometimes we do something and we realize, oh, wait, I should have done this. And we don't really want to have the mistake brought up to us. So if you don't want that, please don't do that to others too, because they won't want to hear it either. And then definitely, if you do engage in a kind of gift giving, I wouldn't suggest to buy purchasing gifts for anyone. And please don't accept gifts as well, because if oftentimes when you buy gifts, you feel obligated to continue to buy gifts, and it becomes a different type of relationship. And if they are giving you something, they may feel that they need to give you something in order to keep your interest. So definitely saying in the first go, I really appreciate you thinking of me, but I really don't need a gift, and I don't necessarily want you to feel that you have to give me anything. So please don't worry about giving me anything for that matter, because this is really for you. We're here together, and this is a really great opportunity to talk to you. So you're showing respect to them, and you're being genuine with them, that you're there for them. Okay.
The issue of gifts can also be a problem where someone accuses you then of taking something from somebody, especially if they're in a nursing home or something, and they might feel they want to give you something because you've been coming into their life and they're really pleased that you come to see them. But you don't want to create any situation where someone starts thinking, first of all, that, as Kathy already said, that you're only coming for the gift, but secondly, that in fact you're taking advantage of this person, and there should never be that concern.
Absolutely. Yeah. Thank you. And then the final thing here is, when you're speaking and you're ending the visit, everyone, like we said, has good days and bad days. And just adjust your style and your visit accordingly. So if you have, a good day, great. Hopefully it stays good to the end. Sometimes there's a saying, if it starts badly, then it ends well, right? And vice versa. So if it ends badly, then try to make up for it the next time. And especially when you end off the visit, to encourage something in that person, a positive outlook, or a positive notion, or something that will bring them some hope, because, you might be the only hope that they have for that day, or even that week. And that's really beautiful, but it's really important for you to know that. When it comes to a person who may actually request prayer, that's great. And if you are comfortable praying with them, please do so. If you don't have that ability that you can just pray on demand, then bring maybe a prayer book with you, something that's easy to refer to, and just have a couple pointers inside that you can actually pull out and have prayers available, so that it's very seamless and smooth for you to deliver on that as well, especially if you know that's important to that person. And they may appreciate it even more so. So that's good to keep in mind. When it comes to a visit, often we'll see short welcome visits are better than long labored visits. And that's definitely the case for me. I feel, a doctor visit is what they call when, you go to someone's home and you kind of say hi, bye, and then you're out of there. That may be too short for some people, but hey, it could work for you or someone that you're speaking with. If they're a busier person, or they feel like they can't make that time happen, then at least that's something that they have to look forward to, is that you are on the same track with them and you actually appreciate any time they give you. When you're planning your next visit, make sure that you thank them and you encourage them to visit with you again, and in a short time frame. If you can afford to see them sooner, definitely opt for that, because it shows them that you actually appreciate them and you value their time, and you're not just pushing off the visit for another week or 2 weeks. You want to actually plan it accordingly so you can see them in a timely manner, maybe every week or twice a week, or maybe twice a month at least. Definitely thanking them, planning the next visit, confirming the time and the date, the location, all of that is really important. And definitely, thanking them, appreciating that you spent that time together is very important here, because the way you sign off the visit is something that they'll keep in their minds, actually. So it's beautiful. And then after the visit, we want to encourage you to get a journal. You can keep notes in your book, or you can actually have a separate journal. And this is, I definitely say this because each person you talk to, you want to note the date, the time, the place, the person's name. And if they keep any information that they've shared with you, you want to put that in the journal. And this is not for them or anybody else's review. This is simply a strategy for you, so that when you visit with them the next time, you can actually review your notes. And if they mention certain things, like, for example, there was an occurrence of abuse, or there was an experience that they had that was really pivotal in their moment or in their life, that you note that you can remind yourself. So when you see them again, you can actually remember, oh yeah, this was something that triggered them to cry. Maybe I should avoid this topic. Or so-and-so, definitely did not look after them when they needed them. Let's avoid talking about this as well. So there's certain points that you can pivot around. Also too, there's certain things that you can note that you can actually emphasize again in the visit that's bringing them hope. So for example, talking about their wedding or their marriage or someone that's important to them really is a nice way to segue into more conversation that will help them open up to you even more. And you can also evaluate yourself in your journal. So for example, if you feel that the visit went really well, then you say, great, this is what I did during this visit. Let me remind myself for the next visit to do more of this, X, Y, Z, do, play cards, or maybe do an activity, or open up a book and start reading to them. There's different opportunities always. So definitely encouraging you on your next visit, what you can do to better that visit and that experience for both you and that person. And definitely you can also put notes on thinking of opportunities for enrichment. So for example, sometimes you may want to arrange a visit to the beauty parlor or a barber shop, or having a service come to them and actually give that service to them. For example, there might be something like a pet that can come into the visit as well, and you can arrange that. And that's really special, because some people are shut in. They're not exposed to certain things, or people even for that matter. And music, for example, is beautiful. I know lots of people who play various instruments. They can actually be mobile with those instruments, like a flute, or piano, even like something like a keyboard can show up, and that can entertain a number of people in that community if you happen to be in a community style type of visit. So those are awesome, great opportunities for you to think of also in your visiting. And if you have any concerns, feel free to speak to your supervisor, whoever it is that you are communicating with about your visits and moving forward with this story and the program. You can also reach out to us. We have an office line that's listed here, 519-439-6445. That'll get you to our office. And also, if you need ever any crisis help, we also have a helpline, which is wonderful resource. And that's a support system that if someone happens to be in crisis, or their family member is perhaps being threatened by euthanasia or assisted suicide, you can actually call and have that one-on-one time with someone who can actually help you through that situation. So thank you. And definitely do stay in touch. So. Oh.
There we go.
Perfect.
Okay. I wanted to make a short comment about the journal, because the journal is a very interesting situation where we have to be careful with a journal, because it's really the information about that person. So these are very, when you're meeting with someone and they share something about themselves, the purpose of the journal is really to help you have a successful next visit. So as Kathy was saying, if they talk about certain things which really made them happy, or if they're, saying certain things about family members or maybe their childhood or something, and they had started exploring it, and then they sort of stopped, and you're looking at that, you can then look at your journal and say, well, next time if we start here, this might be very helpful type thing. But it's privacy that's very important with these things, and I always like to point that out, because you're dealing with someone's private information. It's not our information. We're only keeping a journal not for the sake of, oh, I've got information about this person, or this is helpful. It's actually to help you be a better visitor and know that person better in that sense. And that's the purpose of it. The My Story, well, we have the My Story booklet, and really the whole point of the My Story is we're dealing with trying to help somebody find meaning and purpose in a time in their life when maybe they're having a hard time finding their own meaning and purpose. And so research shows us that when you when you talk to somebody about them and you ask them about them, and that helps them feel better about themselves. So you're identifying with them the important things in their life. You're working with them on their story, and it's very important because everyone has experiences in their life, and we have to remember. So now you're visiting someone who might be, let's say, they're a widow, and they're in their later 80s. They have some health issues, so they're not getting around anymore like they used to get around, and so therefore sometimes these people feel depressed, or they're feeling lonely, etc. And they're having difficulties with self-esteem. They might be thinking, what is the purpose for my living? And what we're doing by reviewing their life and we're writing down the story is we're providing great benefits for them, because they are then experiencing the importance of their own life, the things they did. You know, it's important to understand that we have a future when we know we've had a past, right? It's important to connect these things, and that's what we're doing with the My Story. The My Story, it has, in my view, several great things about it. It helps a person find meaning in their life, but also it helps us with that person establish our own history. So for instance, if you're part of a group, Kathy was mentioning CWL as an example, the Catholic Women's League as an example. And the Catholic Women's League, some of them have gotten really into the My Story, because by speaking to their older members of their group, they're also able to then establish their own history. But the biggest reason for this is by recalling events and feelings and key topics. What you're doing is you're helping them think of their past. You're helping them, share their memories, and they're feeling better about themselves. So this is a form of healing. We're not here to be psychiatrists or psychologists in any way, shape, or form, and we're not trying to be that. But what we are doing is we're recognizing that when you're talking to someone and you're asking them about themselves, that in fact, that improves their feelings about themselves. When we look at the research shows that when you're dealing with this My Story issue and you're talking to someone about themselves, that in fact, that will affect how they feel about themselves. But you have to understand, we talk about issues like suicide and that amongst our youth, and we say how terrible it is that the youth suicide rate has gone up so much in the last many years. But what we don't realize is that the older population actually has a much higher suicide rate than our younger population. And we have to realize that what a lot of these people have gone through is a feeling that their life has lost meaning and purpose, and we're helping them find meaning and purpose. So by talking to them, helping them with their My Story, discussing things with them, affirming them, right? We're affirming them, then what we're doing is we're going to also affect their feeling about themselves. And in a sense, if we're dealing with enough people all the time, we will lower the suicide rate. We will change how people feel about themselves. When I mentioned in the beginning about why people ask for an assisted death, clearly they're asking for an assisted death. Yes, they might be going through a significant health problem, but they're clearly asking for an assisted death for most reasons because they feel there's no reason to live any longer. They've lost their reason to live. So as I say here, seniors at a much higher risk of suicide. Now, when the study was put together, the data changes every year. So I was looking at the recent data, and it's a little bit different. It's actually, though, not the 85 to 89-year-old group that now is the highest suicide rate, but it is that 80-year-old group that is actually the highest suicide rate right now in Canada. And when you look at these issues, you realize what's happening here. With the legalization of euthanasia, we've created greater concern about the individual. You have to, if you're talking about people who have had experience in palliative care too, someone is approaching death and they might have lost feelings of purpose, meaning, or value. It's always important to find that significant issue in their life that discuss to help them, and it helps them move in their life towards a finality that is at least positive. They're feeling better about themselves. A lot of nursing homes you might go to in your life, you'll notice that they have little My Stories on the doors, right? So you go to a nursing home and then there'll be two people in a room or one person in a room, and they'll have a little bit of information about that person on the door. We thought that it was important to go further than that. We recognize that that is to recognize that this person, had a family. This so when you're seeing somebody and you're thinking, well, who is this older person? That tells you a little bit about them. They were maybe they lived on a farm, etc. And these are basic things about them. May have been a teacher, but we want to go further than that because we recognize the importance of the individual. and talking about themselves, and it's very important. Seniors want to connect with their past. See, the reason is that they often want to share their information with the next generation. They've learned things, they've experienced things in life. And I think it's important for the next generation, my generation talking to people older than me and vice versa. I think it's important as we create culture that actually cares about the other, that we recognize the importance of that person. So we must be assured of that one person's meaning in life. So when we're talking to someone and asking them about themselves, for instance, you're asking them about their childhood, for instance, and they're talking about who their friends were, etc. You ask them other questions about that, and you say, well, what kind of things did you do with your friend? They must have been, and you start talking on, and do you have any other memories of this? And that must have been a really important thing in your life. You talk about different things like that that makes them understand they've had these relationships. This is important. We still have relationships. My story helps people connect to their past. Connecting to the past is very important for an individual to find meaning in their life. Loneliness. Well, loneliness is a psychological state, and actually, I think tomorrow I'm going to show you a little video talking about how loneliness, how it leads to a risk of early death. So in fact, loneliness really affects us physically, psychologically, but that also leads us to have health issues. So risk of early death, when we're very lonely, we become often depressed. Um, we want to allay that loneliness. That my story helps people transition in life. It helps them understand their past. Let me give you a little example. Um, Dr. DeVever is the founder of the Euthanasia Prevention Coalition. He passed away a few years ago. And so several years ago, my wife, Susan, um, spent time with Dr. DeVever on basically a weekly basis. And they talked and she interviewed him basically and recorded it all and then created his book, his memoirs with him. Now that was very important because, like everybody in life has their issues, things that have happened to them in life. They have their relationships, they have their children, they have their wife or husband, if that be right, obviously, right? And so therefore, this was an important way to affirm all the wonderful things he had done in his life. And he had done very, very many amazing things. And I make the comment that, as they were older, everybody has their difficulties, but this work of my wife Susan working with Dr. DeVeber on his book. Now, I'm not asking you to work on a book with somebody, but the fact of it is that really helped in the final years with Barry, Dr. DeVeber, and the relationship with his wife, Iola, because they shared these experiences that they had from their younger years, and they ended up doing a lot of this together, and it made a huge difference in creating a sort of like a final healing in their final days of life. And they were much older then, and it wasn't that much further. It wasn't much before actually they had died. So it was actually a great experience. Self-awareness and self-discovery. Well, it's important to reinforce our place in society. A lot of us may think that, what have I really done? And when we start talking about it, we realize all the people we've influenced in our life, and that's important. As an example, when we're working with the Catholic Women's League groups on their, visiting and their My Stories and that, what happened is that there were certain ladies who were saying, I want to share my story too. So it started to blossom out where people would say, I want to be part of that also. And it was an important thing to recognize that the process of speaking with people and learning about them, and also discovering our own history or their own history, that others said, yes, I want to be part of that. So it created, how would you say, a growth in its direction. Reminiscing is important. Um, a lot of people talk about reminiscing as a type of a therapy. It's good for the brain, it's good to remember, but it also makes us feel better about ourselves. Now, some things, of course, are not going to make them feel better. And this is a very difficult thing because obviously there are times when you'll be talking to someone and it's going to open up other things. I'm going to get into that in a minute. These are difficult things that might happen, but the total issue around My Story is positive. It helps a person reconcile with their past, and this is very important. Whether we like it or not, we all have pasts, and some of us would have a greater issue than others, that there are unresolved issues from our past. And of course, with this issue, we're visiting someone, we're talking to them, we're asking them to share their past and things. We're not trying to in any way create a difficulty. And of course, we do so, in a way that only what they want to share is what they will share, and it's not for us to play psychiatrist or psychologist. What we're doing is we're a visiting person. We're spending time with another person. But it does fulfill a psychological need for an individual. You're helping them think about their past and reconcile, even if you're not actually doing anything intentional to come to that. You're helping them deal with their past. This whole concept of dying healed is sort of important, because as we approach the final years of our life, many of us feel the need, or will feel the need, to have closure. And obviously the My Story helps with that. So every time I hit a button, then I have to go here to move. Social isolation is a serious problem. And I've already mentioned in my previous earlier little presentation how big a problem this is. Social relationships. Now, obviously people who attend church might be less socially isolated than people who don't. But one of the problems with when people start getting older is they often will develop some types of disabilities, meaning that they can't walk like they used to walk. They have difficulty getting around, etc. Or they might be losing some of their eyesight, or having a hard time seeing. They might be losing their hearing, etc. So obviously, a lot of these issues with their age, the fact that the people who were their friends have now passed away, some of them have passed away, family members may not live nearby anymore, which is a real important part of our culture today, that we have such a social, dispersion. Like, it wasn't that long ago in history where if you lived in a community, you might live in that community most of your life. In the video that I showed at the beginning, that one lady from the UK, she grew up in that house. And then when she got married, she stayed in that house with her husband. And now she's in her 90s and she's still in that house. Now, that's not a common thing in 2022, but 50, 60 years ago, that was a bit more common. Today, someone might have had 3 or 4 kids and none of them are nearby. They don't have that same type of thing. Social engagement is very important. And so what we're doing is we're recognizing that in the nature of the human person, and we're trying to prevent isolation. Our focus is to validate that person. It's not about me. It's not about what I'm trying to do. I might feel myself validated by spending time with another person. Somebody might really enjoy it. They might really enjoy spending time with people. But in fact, what we're doing is we're validating that individual. And the best way to make this work is we're working usually within a parish or community setting. So therefore, it makes it, we have a natural connection with that person when you're visiting them, even if you didn't know them before. Special individuals with a lifetime of experiences, what we're really emphasizing here, that everyone has important things in their life. Trauma is a reality. Um, there are people who have experienced very terrible things in their life. As an example, my mother was involved with doing several of my stories, and she contacted the one lady who she knew this lady was on her own. She was not really getting around anymore very much. And she had known this lady for several years. So she talked to this lady and she said, oh, let's talk about your past and everything. And this lady was happy to talk to my mom. And my mom was obviously going through my story with her, etc. And she found out quite a bit about this lady's past that she had no idea. No idea. And she wasn't trying to bring it up. She wasn't in any way trying to, tease it out of her. And it's like, this is a woman who started talking about these things. And the hope is that it creates a sense of hope, a healing component. They're talking about things in their past. We're not being judgmental. We're just visiting somebody. Obviously, this is not necessarily what it's about. We're not trying, but these are realities of the human person that will come up, that someone will have experienced trauma in their life. Now we have the My Story booklet. So, we could go through some of those questions together if we need to, but there is, it's just a booklet with suggestions in it, etc. And it's a guide to actually going through questions with people. Some people might not want to talk about many of the questions in there, and maybe they want to focus on, the years when they had a family, or maybe whatever they want. Maybe they want to focus on their childhood. Maybe they did very well in school when they were younger, and they want to focus on those things. That's what they're going to do. So we have that booklet, and we're happy to share it with you either online or send it to you. We have lots of them printed, but it's important to recognize what we're trying to do here. Now, once again, the My Story concept is also a door opener to the visiting. So Kathy's talking a lot in her presentation about the importance of the My Story. The My Story actually is how would you say, the wheel that moves the cart. The purpose of what we're doing is we're visiting people who are lonely. We're visiting people who we know in our communities. We're recognizing the interdependence of the human person, interconnectedness, and the importance of being with others. We're recognizing if we're in, let's say, a church community, for instance, that we should be reaching out to those in our community who aren't maybe at this point in life capable of coming and being part of the community on a Sunday, as an example. Or maybe if it's a Catholic Women's League group, these are ladies who used to be involved, and now because of their health conditions, their age, their residence, it's possible now to live in a nursing home or such something, that they're not able to come to those meetings anymore, but they're still part of our community and they're still important. We recognize the importance of the human person because we're recognizing from the very basic nature that I, as a human being, I interconnect with others. And this is very, very important. So we recognize the importance of the interconnection. And when we don't interconnect with others, we have a lot of difficulties in life. So the whole concept of euthanasia and assisted suicide, and suicide itself actually is a very similar component. It is being, how would you say, it's growing and it's flourishing in this culture because we have a culture of loneliness. We have a culture that has become separated out. And as I say, we have these booklets for you